Good evening. Tonight I'm going to talk to you about why I believe a physician should be in the House of Representatives. My career as a family physician has spanned 4 decades. I have worked in big city emergency rooms, on an Indian reservation, jails, but most of the time, rural East Tennessee towns. Many of my patients have had little or no health insurance and suffer from the consequences of poverty, mental illness, and drug abuse. I know, and not just theoretically, the catastrophically adverse effects on a person's health of a dysfunctional healthcare system. Over the last 120 years, there has been an extraordinary improvement in the overall health of Americans. In 1900, the average life expectancy of a white male was 47. Today, it is in the high 70s. Only 12% of people born in 1900 reached the age of 65. Similar improvements occurred for white women and African Americans, although for the latter, the absolute improvement has lagged behind that of whites. Infant mortality in 1900 was 165 deaths per thousand live births. Today, it is less than 8 per thousand live births. Physicians can proudly claim that their efforts are responsible for these accomplishments: immunization, antibiotics, and breathtaking improvements in surgical techniques are incontrovertible evidence of the benefits of marrying biological sciences to the healing arts. But honest reflection should temper this boosterism. One can seriously argue that most of the achievements in population health are a consequence of improvements in the social determinants of health. The World Health Organization identifies 10 social determinants of health. They are the social gradient, stress, early life experiences, social exclusion, work, unemployment, social support, addiction, food, transport. Noticeably absent from this list is medical care per se. It is not that medical care is unimportant, but rather many other factors have had a greater impact on both an individual's quality of life and its length. And physicians need to recognize that their unique contributions are most beneficial when coupled with a concerted effort to mitigate the adverse social determinants of health that plague their patients. A healthcare system that refuses to acknowledge the complex interaction of the social determinants of health and medical providers' work is doomed to spend a lot of money and accomplish very little. To prescribe a lipid-lowering drug to someone who's homeless or struggling with addiction or unemployed is as useful as rearranging chairs on the deck of the Titanic. Physicians can leverage their special role in society if they are willing to be catalysts for change in how we educate people, how we house people, how we employ people, and how we support people. Now, admittedly, this type of work takes physicians outside of their traditional boundaries, beyond their scope of work. But let's be honest. Ensuring that all residents of a community have access to clean water free of lead achieves more than treating victims with chelation therapy. Not as exciting, but from a society's point of view, more cost effective. Bringing fully stocked grocery stores, and parks to neighborhoods will have a greater effect on obesity rates than bariatric surgery. Not as dramatic a solution, but from a society's point of view, more beneficial. The overwhelming evidence that adverse childhood experiences have long-term deleterious effects on the quality of a person's life as well as its length demand that physicians and all others in the healthcare field partner with professionals in social work, mental health, law enforcement, judiciary, drug rehabilitation, and education to first mitigate and then eradicate the environments that serve as breeding grounds for childhood trauma of any nature. Physicians have many tools in their toolbox, but they are so much more useful when others bring theirs to the worksite. Targeted immunotherapy for genetically mapped malignancies is a medical tour de force, but in the grand scope of our work, much more can be accomplished for the health of a population if its members breathe clean air, drink clean water, eat high-quality foods that are free of toxins and pesticides, live in affordable housing that is environmentally safe and structurally sound, reside in neighborhoods that are free of crime, work in jobs that are safe and meaningful and provide a living wage, can live safely and travel quickly to their place of work, have access to an educational system that is competent and comprehensive, and have access to social services networks that are able to support them in times of trial and loss. When I completed my residency, the medical director delivered some sage advice. He said, if things are going wrong, Han, do something, anything. But if things are not going wrong, don't do anything. Things are going wrong in this state in many ways. I intend to do something. And in the House of Representatives, I will bring this point of view to the table of decision makers.